presentation. Let me tell you a little bit about Matt Trowbridge that I know about. And then, first of all, in terms of the official credentials, he's an MD and a prevention public health researcher. That's a bit of an unusual combination in and of itself. Also, if you look at his resume, it's not the resume of a vita of a professor in the typical sense. And in fact, when we first met, we had a conversation that was about whether he might not be on the right path for a good, successful academic career. And thank God that he's not. He's focused in a way that I haven't seen a lot, and that led to several enjoyable discussions and luncheons about far-reaching topics. So it was a great pleasure. But in each case, he was making linkages and thinking about things that I'm trying to think to myself, why is this MD and even this public health guy thinking about architecture, thinking about how we design walking to school, and thinking about how eating might be related to how you lay out a lunchroom. And I thought, this is really great. And really, how does that relate to the way physicians might talk to their patients and things like that? So that's who Matt Trowbridge is in terms of an introduction. He's somebody who sees the linkages that other people don't see. He sees the big picture, and he sees how the intimacy of a physician-patient relationship is connected to something like how kids get to school and how we design schools. So with that, it's my pleasure to introduce Matt and to let him give the talk on health in place and how our built environments impact children's health. Matt?
Thanks very much. This really is, I didn't even do that. Let's see. Okay. So actually, it's already been an amazing morning, and I promise that this slideshow has really been designed for you guys to just see some beautiful pictures, be inspired, and maybe just try to, as Patrick kind of alluded to, the work that I'm drawn to is about linkages. It's about applying new perspectives, and I think I'll even go so far as to say what I feel like I am about, and I feel like part of the discussion we're having today is how do we create a culture of things like physical activity, and part of that, of course, is thinking about literally the environment around us, the built environment, the how does that play into these discussions that we're having? So with that, my goal today is really just to kind of maybe give you a sense of how I think about things, how I approach these things, how I approach collaboration. And importantly, I think people, the show of hands, the term built environment, is that pretty familiar to people? Okay, that's what I figured. I was hoping I was talking to the choir here a little bit. But I think so what I wanted to do first was kind of talk about, let's put this new term built environment in perspective of kind of where it's evolved out of in terms of public health. And of course, any epidemiologist in the room will of course recognize this picture without me even telling the whole story. This is of course John Snow's pump with the main thing, of course, is that it's missing the handle in London, which refers obviously to the famous cholera epidemic back in London, where he was one of the first folks to really think about data and what sickness or illnesses and put them in an actual location and think about what was going on in the environment that was causing the illnesses that he was seeing as a clinician. And I think that's the key thing that I wanted to start off with, is thinking about environmental health in public health as historically was one of, like, you see a person come in who has something going wrong, and you look out into their environment for an explanation, and you go remove it. Okay, great. Similarly, lead toxicity. Again, you see a constellation of symptoms in a child. You do your tests, and then you go out and you do lead abatement and so forth. But things have started to shift, and over the last maybe 10 or 15 years particularly, we started thinking about looking at the environment and environmental health in a pretty different way. We started having really interesting studies come out that started to challenge this idea of looking really granularly, like one house at a time or so forth. This is a really fascinating study. It's just one of my favorites. Journal of American Medical Association, and back in 2001, I was actually in medical school at Emory during the Atlanta Olympics, And what was really fascinating was Atlanta's, obviously, we've been picking on Atlanta today. That's too bad. I'm from Atlanta originally. But traffic has always it was an issue, and it was predicted that during the Olympic Games it was going to become so bad that actually what happened is everybody left, and there was a pleasurable couple of weeks during the Olympics when it was actually quite easy to drive around Atlanta, and it was a strange thing. And there's so many people. There's all these CDC folks in Atlanta that recognize this smells like a natural experiment, and so that's what they did. What they did was they looked at all sorts of known triggers for asthma in the environment, and looked at the fact that during the Olympics, when we knew that the driving patterns had gone down significantly, that indeed the triggers for asthma had gone down, and they were able to link it and show actually during that same time period that there had been a 43% decrease in Medicaid claims for acute asthma during that time. Pretty dramatic. And similarly, I think as we started to think about the built environment or what's happening in transportation patterns and things like that, and trying to link it to other problems that we're trying to deal with, similarly, we started thinking about childhood obesity. What's going on? Where are our physical activity patterns changing, and so forth? And these data we've talked about in several forms today, but this is trends in U.S. children's travel to school, done by my good friend Noreen McDonald. And she used the National Household Transportation Survey, which is done every few years, and she basically looked at, in 1969, you can see the kind of gray line is kids getting to school by walking or biking was over 40%. And then let's see if this clicks. But by the time we got to 2001, that percentage had dropped around to 12% or something like that, which is obviously dramatic. And we started thinking about this, to collectively, and public health started to think about, well, what's going on? Is this really environmental health that's going on in the way that we've been thinking about lead toxicity or air pollutants or cholera outbreaks? Maybe there's something going on that's not just environmental health, and instead there's something going on that's maybe this is actually environmental design. What's shifted in our environment that has so dramatically changed our behavior patterns? And this started, I think, a really exciting realm of expanding the idea of environmental health to include the built environment. And basically, as we started to look around with this perspective, we started to realize that we really have created these brand new environments over the last few decades. And as humans, we're not very good at recognizing when things are brand new. 50 years is a long time to all of us. In reality, urban sprawl conditions like these ex-urban areas, they've never existed before, okay? And they're having a dramatic impact on our reliance on automobiles for daily transportation. We've created, as I always like to say to my students, situations like this are a wildly experimental condition. This was a farm. This was rural land, and we've packed it full of these new developments. And we really are just coming to grips with what are the public health impacts of creating these new experimental conditions. And I can tell you, I won't even get into it, but we've let the indirect costs of these types of decisions get away from us. Like my actual department is actually emergency medicine, and I've done a lot of work thinking about providing EMS care in these types of circumstances. Really hard. I'll just leave it at that for now. But let's see. And then we've started. This is an iconic image in the physical activity world. It's just kind of passed around. But it makes it. I think we can all think. We laugh at it, but this is a real place, and this is it's emblematic of a way we've started to approach designing our environments. We've kind of designed physical activity out of our daily environment. A culture of inactivity, a culture of driving is very pervasive. And so what's exciting, though, is that we have started to reorient towards maybe a more active way of thinking about environmental design as opposed to just being reactive when the patient comes in the door. As case in point, in 2009, the American Academy of Pediatrics convened a formal task force, and they looked at the built environment and thought about how to design communities to promote physical activity in children. And one of my favorite comments that come out of that is just, it's pretty straightforward but pretty profound. You know, a pediatrician's recommendation that a patient get regular physical activity loses its salience if this patient's everyday world lacks opportunities to walk, play, or run. And that's overlaid by all the things that we were hearing from Dr. Dietz and others about. That's not even mentioning safe. You can put safe in almost all of those things, and that's important, or enjoyable, or economical, or exciting, or beautiful. It's okay to think about aesthetics. I'll get to that in a point. We're not allowed to say that for some reason in public health, but it's, as we all know as humans, so much of design relies on satisfying all those types of things. So it's also important, I wanted to say, while I do a lot of obesity prevention research, as I said, my own background is actually in injury prevention and so forth. So as we go into this realm, it actually goes into one of Dr. Dietz's like 5 recommendations of how we have to make physical activity and changing things that promote physical activity pay off in a lot of different ways. And I think similarly, the discussion about built environment and public health has almost been synonymous with obesity prevention. But in reality, if you stop and think about it, again, as a human being, not necessarily a public health researcher, you could just keep making lists and lists and lists of things that are health-related that are definitely impacted in some manner by the built environment. Just to give you one example from my own background of traffic injury, you know, I actually entered into the built environment and public health research realm through traffic injury. It wasn't through obesity prevention, and specifically through teen drivers. But I include both these pictures here because I just wanted to highlight that in traffic injury, actually, particularly driver safety, the 2 groups that we most care about and we fret about are young drivers and older drivers for very different reasons, but this next slide shows why. Here's, like, if you look at fatality rates per 100 million miles traveled and years, and then you can see a pattern, perhaps. There is and basically the scale also is important to notice on the bottom. If you notice how dramatically the risk falls for a 16-year-old versus a 17-year-old versus 18-year-old. And on the right, it's always really important to say that it starts getting, you know, the age categories get broader. It actually brings up a really important point, which is both of these groups really actually, they are desperate for mobility. They really want to be mobile, okay? It's not driving as much as it's mobility. But these 2 groups require totally different things. And unfortunately, right now, we've been addressing them mostly through like airbag design, which I've done a lot of. I've done a lot of like statistical work on that. But that's not the right answer. I mean, on the left side, you know, our young drivers, it's all about helping them not to have to drive as their brains are maturing, as they are gaining more ability to have impulse control and so forth. Risk is a normative part of being a teen, and we're giving them a car, and they have to drive. And similarly, older drivers, you know, chronologic age is a terrible predictor of driving performance. And so it puts physicians in a very difficult position when they're living in one of those exurban environments if you tell them they can't drive anymore. So I guess I wanted to make sure, as we think about these things that will have an impact on walking, physical activity, making more walkable communities has these other implications. Some of them are very profound, like reducing people dying in traffic crashes and so forth. And so just to show some of the science that we've done from this thing, this was a paper I did actually with Noreen McDonald, where we thought about what is the impact if you see how dramatic the risks are per mile traveled for young drivers. We looked at how does urban sprawl actually impact driving exposure in teens. And we used a quantitative assessment of sprawl. And so we weren't just looking at Manhattan versus rural. This is looking at suburban areas that have differing degrees of sprawl. So maybe like a traditional suburban area outside of Philadelphia or something, a more traditional transit-oriented area versus a very sprawling area. And what you see is, let's see, among our most kind of concerning group, the young males, it's pretty dramatic. If you have a compact suburb, there's about a 9% chance that males in those types of suburbs will drive, and so it's not just ride, like literally be behind the wheel, more than 20 miles per day, as opposed to in a sprawling suburb, it'd be close to 24%. To a traffic injury researcher, that is a terrifying number. And it's also because meanwhile we're applying policies very kind of homogeneously for graduated driver's licensing programs and so forth without paying attention to where things are happening. And I think that's the key thing that we can take from these kinds of things. And the other key thing, obviously, and it's important to think about this as we talk about physical activity as well, is it's not just that they're doing more driving, it's the type of driving, it's the types of experiences that they're having. The young kids, when you talk to them, they're growing up in Northern Virginia, suburbs and so forth, they're learning to drive in this stuff. So they're driving more than 20 miles a day in this. That's really scary. And I have young kids, and I'm hoping that Google gets the driverless car here as soon as possible before we have to deal with this. But anyway, big thing, and the key thing I wanted you to take away is the idea of where matters when we think about these types of things. All right, come on. Okay, so how do we operationalize this? In the end, this is a lunch talk. This is not supposed to be a super heavy thing. So I want to make sure, so join with me, and I'm going to try to bring you across the way I've been starting to think about this, and actually reasons why I'm pretty excited about opportunities in this area. And I will get to the project that we were referring to that Youth-Nex provided funding for related to school design. So one of the key things that makes me excited is we actually are starting to have real sources of inspiration. Like there's places all around the world now that we can look to that are just going ahead and doing really interesting stuff that is evidence-based, but evidence that's broadly distributed across a lot of disciplines. One place that's really amazing is New York. They've just made some incredibly aggressive changes in their built environment. And things like, if you haven't been to New York in a while, you should go. It's really interesting. I mean, they've taken places like Times Square and with paint and large planters essentially turned the Times Square and large sections of Manhattan into pedestrian-only places. And now there are cafe tables everywhere, and they've created these really vibrant public spaces. Totally interesting. Going on right now, natural experiment, just incredible. They're also doing things like the Highline Park, reimagining infrastructure. Where I don't know who's been to the Highline Park here. I mean, it's really incredible. It's basically one of these, a remnant of an old elevated, highway, these bypasses and so forth. And they essentially, you walk up off a Manhattan street, and suddenly you're into this completely different environment that is not just kind of cool that it exists. It's absolutely staggeringly beautiful. And every inch of it, now that I know how much it costs to build things and design things, every inch of this place has just been designed to be amazingly beautiful and engaging. And it's one of the most popular attractions in New York at this point. Am I saying we're going to build a Highline Park in every city in the United States? No, but the attention, really applying real design, really allowing designers and design thinking to kind of permeate into these types of decisions, you end up with things like the Highline, which really work and take advantage of things that are there. So that's one of the, it's just also inspiring is the key thing I wanted you guys to take away from that. And you should go and visit it. Also, at the same time, huge investments in bike lanes and bike infrastructure all around New York, and also in Washington, D.C., it has made possible these amazing things like the new city bike share system in New York. Again, transforming Manhattan as we speak right now. I think they lost about 4,000 bikes in Hurricane Sandy, so they're well below capacity right now. But they have something like 5,000 bikes or something in Manhattan, and I've talked to the main guy that runs their system. They think they're going to have about 25,000 bikes in their system when they reach capacity. And this is New York, so before it showed up, everybody was yelling about it, nobody wanted it, anything like that. So fast forward just a few months, okay, and it was Fashion Week recently. I don't know if you know, in Fashion Week, I didn't know this. I happened to be there during this time. Every year they announce the color of the year, Pantone. Guess what the color of the year is? Dazzling Blue, which is the city of Capital Bike Share. And so actually, all kidding aside, when you go to Banana Republic or wherever, you will suddenly see that blue is permeating the fall. So I want you to think of it as City Bike Blue, okay, not Dazzling Blue. So physical activity, getting out there on bikes, it's happening. And I will pause. I didn't go heavy on some of the data and research side on this. The cool part about it is, too, that these types of systems generate real-time data like all the time, and people and data visualization specialists are having a field day with this stuff. There's actually some really interesting, I just saw a really interesting article written about how city bike data and bike share systems all over the world actually provide really fascinating and useful kind of vital sign data for urban systems. You can see how people are using public transportation. You can see their movements. You can see who is using them, who isn't. And so anyway, it's another opportunity that's pretty exciting for research. And then we also have new tools, again in New York, but this is also, there's lots of these types of adventures going on. People are starting to actually form collaborations between design and public health and make actionable tool sets. So things like the Active Design Guidelines, which was a collaboration between New York City and the New York chapter of the American Institute of Architects. The key thing is that they took things that like physical activity evidence and constructs, but because they worked directly with designers, they were able to turn it into something that an architect would be used to seeing. It gets really specific. So if you want to promote stair use in a building, they sat down and really thought through all the things that would have to happen for you to have really prominent stairs. You know, the lower picture there, it's harder to see. You immediately run into fire codes, and how do you have glass looking into you know, fire doors and stuff like that are all compliant and so forth. But it then turns into like lighting them, putting music in them, you know, where to place them. But the cool part is that now not only architects know how to do it, but they also get credit for doing it, which is an important thing. They can say they're doing active design, and it can be a prominent part of their project, and that's a big deal. So another key thing, there's seriously there's so many things, exciting things going on around the world. It's not just New York City. But there's also really cool inspiration, and this is something that I'm working with now a lot. We can also look across at entire movements, like the green building movement. How would we make physical activity in the built environment more pervasive, more systematic? Well, one thing I think we can do is take a lot of inspiration from the green building movement, which things like the U.S. Green Building Council, who runs the LEED certification system, if you've ever seen buildings that are LEED gold or silver, it means that project has met a certain number of criteria. They've used strategies that are recommended and have achieved a certain number of them, and so they've achieved a rating. And it has real economic value in the marketplace is the key thing. And the cool part is actually, living in Charlottesville, I actually have access to some amazing, you know, there's a great architectural community here, and we have a really renowned school architecture firm, VMDO Architects, that I was exposed, you know, to some of their green buildings, and it really inspired me. So this is like Manassas Park Elementary School. Again, this was focusing mostly on green things, but you start to see things like these kids are sitting not just in an amphitheater. This is actually the stormwater management system. So when there's not runoff, it's a cool amphitheater and the bus and the waiting area where kids can wait for their moms and dads to pick them up. Obviously, when it does rain, water comes in and fills up and shows the kids that they're able to quantify how much water was occurred during that. You can have discussions about, you know, floods and so forth. But it's also beautiful. And remember, this is replacing a dangerous chained link fence surrounded thing in the back. You know, now it's suddenly a beautiful prominent part. Similarly, you know, again with stormwater, this is their cistern, and they even made a custom barber pole that shows the kids how much water happened. And it's always one of the things that really inspired me learning about this project from VMDO was it's accompanied by high quality signage. And if you go to this school and you ask kids about their watershed and everything, they know. And so amazing. They have systems like these green light systems that were developed where when the atmospheric conditions are correct to open the windows, the green light will come on, the HVAC systems turn off, and the kids jump up and open the windows, and they love it. The point is the building becomes a classroom. The building itself is a teaching tool, and that's an incredibly interesting thing. And as I mentioned, it goes all the way down into having very high-quality graphic design, signage throughout the building to emphasize the teaching points of the building. And so this concept of like, how do we use like the structure of green building, the things that have been learned from sustainable building, these ideas of buildings as teaching tools, how do we use that for public health potentially. And this actually was formed, a lot of the work I did as an interagency personnel agreement with NIH. I worked for a couple years with them, and we developed, this is available for download, a report and an initiative directly collaborating between these federal agencies and groups like the U.S. Green Building Council to think about that exact thing. And I urge you to check it out. It's pretty interesting. And here at home, what I also was inspired to do was, and this is where Youth-Nex came in and provided some support for us to really try to get our hands dirty and see how we could do this. So another public health colleague of mine, Terry Wong, and I, we partnered directly with VMDO Architects, and what we first did is we did, I think, a really exciting and very innovative collaboration where we tried our best to think through a school environment, take this constructs of teaching, using the building as a teaching tool, but apply it this time to public health, and specifically creating an environment for teaching healthy eating, and also encouraging healthy eating on a day-to-day basis. And I also encourage you, this was published obviously in Preventing Chronic Disease, Open Access Journal. You can read about our entire process there. The key thing is that then VMDO took the design guidelines, and no small feat, did a major renovation of this school, Buckingham Elementary, that's just south of here, and applied the healthy eating design guidelines in their design. And the resulting school is really, I think, really amazing. These are all renderings, but what I wanted to show is basically what we did was we went through each of the kind of major spatial areas in the school and tried to think about them carefully, thinking about the active design guidelines, the way they gave really specific, actionable ideas. One of the core foci of the school was, of course, the dining commons, which VMDO has kind of come to say, reimagining the cafeteria as a classroom, essentially. So basically, the cafeteria includes a dedicated teaching kitchen, which is set up so that it could be used after hours for community, but also is available as a classroom during the day. You can see that it has a food lab and lounge, which is like a kid-centric kind of resource area where they have amazingly cool. Actually, we have one of our furniture suppliers, VS Furniture. They have amazing, really engaging kid-oriented furniture with these active stools and all these things that it's amazing. And it's all right there in the cafeteria. It allows this space to be a teaching area. And similarly, we also included a kitchen garden in the actual core design. It's not an afterthought. It was programmed in, as well as really careful thinking about visual connections between things you were trying to make. And this is just one component of another key point is obviously we also, a key design strategy was to allow an open kitchen so that the kids and the food staff are able to directly engage, and that the food staff becomes more engaged as an actual part of education, the education of kids about food. And these are just some more close-ups of the renderings of what those spaces, they really do look like this. And they're just some of these spaces a little bit more detailed out. And again, here's a rendering of the outside area where the school garden is. And again, I wanted to say we repeated things like really thinking this all the way down to the level of graphic design. There are these really, to me, I'm really excited about these moments of like where public health is always, we're talking about emphasizing water consumption as opposed to sugar-sweetened beverages. Well, one of the really purposeful design moves was to celebrate water, not just have it available, but like really have the water fountains be placed very strategically, they're offset with color, and they have signage right there. Similarly, it's also important that the iconography is consistent throughout the school. It's not random. And adults kind of miss it, but kids do not. They know where they are in their schools, and they really respond to this. And so things like the stair use and the water use things get used consistently, and again allows it to be makes it easier for teachers to build upon these as teaching points. And then, the amazing thing about this stuff is that this is the kind of thing that sounds kind of like space travel, and I think VMDO and we can say that it felt like that at times. It was hard work. But this place exists. It opened. And with the Youth-Nex funding, we're actually in the process of doing an evaluation of a cohort of children. We followed them through from their old school, which didn't look anything like this, I can promise you, and moving into the new school. And it's a heavily focused on qualitative research to really try to understand the culture shifts that we expect to be occurring through this. And not just the children, it's teachers and staff and community as well. And we're there, everybody's getting excited. The schoolyard garden is coming along. It's being developed by the community, and the teachers are really starting to utilize it. And it's an amazing place, just about an hour south of here. So basically, that's a 10,000-foot view of the way I sort of come to think about some of these issues. I just encourage you to think about where things are happening. I really encourage us as public health folks to engage in design thinking. Not just think about design at the last minute when we're making the reports, but let's seek ways to directly engage with designers and the design community. They're really smart at thinking about culture change and social movement design. So with that, I thank you very much for your attention, and I look forward to your questions.